Ribi nice. Atike one Arabambi.
You wanna live long, you wanna stay strong. You wanna live long and stay strong. Fúnni ni wọ́n sọ, olóyún abẹ́rẹ́, láì ṣiṣẹ́ abẹ́, ewé ń jẹ́, ogun jẹ́. Má ṣe lògùn without doctor's prescription. Mo ń tẹnumọ́, call on doctor's attention if you need solution. Mo ń tẹnumọ́. Too much is given, much is expected. Ìlera lọ́rọ̀, ìlera lọ́rọ̀.
Saturday, aláboyún ẹ múra o. Túbọ̀, bó bá ṣe bí ẹni bá rẹ̀, àbíkọ́jú máa ṣú. Aláboyún oníbòmí náà tó lé lọ́kọ̀ ọjà síbí tù. Onípele ra lọ́rọ̀ o. Àgbo ṣe dáadáa bá aláboyún ṣùgbọ́n ẹ má ṣe ṣe ìwọ sọ sílẹ̀ o. Ẹ ò gbọ́dọ̀ dọ́kun o, láì sáṣẹ dọ́kì o.
Mo kí gbogbo wa káàbọ̀ sí ètò tí a ń ṣe léni. Ètò tá a ń ṣe léni yìí ni a fẹ́ pín káàdì ìyẹn ká ìwé ìdánimọ̀ fún ti SCHAF Ọ̀yọ́ State Health Insurance Scheme. Èyí tí a ti ń gbìyànjú láti jọ ẹ̀ tẹ́ bá rántí ní June 19 nígbà tá a ṣe àyájọ́ ọjọ́ Sickle Cell Day, wọ́n promise wa pé ká wá ṣe health insurance scheme.
In the foundation, the only thing that happen is that there are groups of people called sickle cell, people living with sickle cell. From the knowledge I wà ní lórí ìwé kíkà, a mọ̀ wípé a lot of challenges are facing this people. And if the challenges are there, tá làwọn tó máa ràn wọ́n lọ́wọ́ gan, àwọn doctors, àwọn nurses, àwọn researchers, àwọn èèyàn míì tó kàn wọ́n wípé téèyàn mi lẹ́gbẹ̀ẹ́ mi bá ní ìjọba ẹ̀jẹ̀ kì í ṣe fún. So this foundation is one of them. To believe wípé sickle cell needs to be put in the place where it is. Like he said last time, Mr. Olulowo said, mo ní sickle cell kọ́ ló ní ní. I went home with the knowledge from that. Ẹ̀yin ní sickle cell disease or sickle cell disease kọ́ ló ní ní. So nítorí náà kí la lè ṣe láti mú wàhálà sickle cell wá sílẹ̀ ní Nàìjíríà? Wọ́n ti foundation wa wà fún mi. So àtẹni tó wà ní foundation wa àtẹni tí ò sí bẹ́ẹ̀ gbogbo ìta bá ti lè rí wọn á sọ pé kí lẹ lè ṣe láti ràn wá lọ́wọ́. Kí la lè ṣe láti ràn wá lọ́wọ́? That is why we are here. Ẹlòmíì fi jẹ́ ẹlẹ́sìn òsáré bọ̀ torí ọmọ yìí ó dẹ̀ ní insurance. Àwọn SCHAF, I thought I would be able to show them off this morning. Ó ti tọ́dún mẹ́rin bí márùn-ún tá a ti ń bẹ̀bẹ̀ wípé ẹ bá wa ṣe nǹkan pa sí ìfẹ́. Wọ́n ní this and that pé kẹ́bẹ̀ẹ́ ọ̀gbà tọ́lọ́ máa ṣínà last June wípé kán ràn wá lọ́wọ́. So ẹ bá mi pàtẹ́wọ́ fún SCHAF Ọ̀yọ́ State. Ìkòrí kẹta ni wípé research is very important. Research is important to us, and if we don't do research, we'll be working like people in the 1920s. So we look at what is happening today. That's why we can tell you in the forefront of science, there is now a cure in Nigeria for sickle cell disease. Fẹ́ni tó bá lè afford ẹ̀, fẹ́ni tẹ́jẹ̀ bá bá rú ẹ̀ mọ́, fẹ́ni tó bá lè ṣe so many things about sickle cell disease. láti cure rẹ̀. It is now available in Benin and it is also available in Lagos for whoever can afford it. It's a lot of millions of people and the conditions have to be right to get it done. It's not something you just walk to usage and say I want to do bone marrow transplantation. No, there are specific places that can do it and they too are still struggling to start. They are starting now. So these are the things that are research oriented and care oriented. Another thing that we are doing is advocacy. Advocacy labadodo or OISHIA. Advocacy means you are begging somebody for something that can be useful.
So adójútó ìpínlẹ̀ Ọ̀yọ́ kí ló dé tí a fi na owó ẹ̀ sí kẹ́yìn náà lè jẹ́ àǹfààní ẹ̀. Ẹ̀yìn tó a fi ṣe bẹ́ẹ̀ kò mọ̀ rárá. Torí tó fà ní pé ètò adójútó wà fún gbogbo olùgbé ìpínlẹ̀ Ọ̀yọ́. Lótìtọ́ láti dára orí ẹgbẹ̀rún mẹ́tàlá àti àbọ̀ 13,500. So tẹ bá fẹ́ ṣe ní ti owó ẹ̀rọ wípé 800 slot times 35, that's 8 million, I mean 10 million 800,000 naira. Ẹ̀pàtẹ́wọ́ láàrín. Èyẹ ní ti owó àti darapọ̀. Ṣùgbọ́n 13,500 yìí àǹfààní wo ló fún ẹnì kọ̀ọ̀kan? 13,500 ó fún ẹnì kọ̀ọ̀kan ní àǹfààní àti gba ìtọ́jú tó tó 500,000 naira ní ọdún. Àwọn ọmọ ṣe nígbà tí ètò adójútòfò yìí bẹ̀rẹ̀ àwọn dàbí ìgbà wípé àwọn tó ń gbé pẹ̀lú sickle cell ẹ̀rù ń ba insurance láti fún wọn sí ẹ̀rù máa ń bá wọn ní insurance wọn á ní kò sí fún wọn. Kí ló fà á? Ẹni tó fà á ní pé wọn àti ilé sọ wípé ẹni tó bá ní nǹkan báyìí iye tá a fi tọ́jú ẹ̀ ní ó ṣòro. Torí ẹ̀mọ̀ pé ọ̀pọ̀lọpọ̀ gba crisis lè wá oríṣiríṣi so insurance ò tí lè sọ wípé iye tá a fi tọ́jú ẹ̀ ní. So anything tí insurance ò bá lè pín price àbí cost ó máa ń ṣòro fún wọn. Ṣùgbọ́n ní ìpínlẹ̀ Ọ̀yọ́ àwa dà wọ́n pé àkótí ẹ̀dá tí èmi sickle cell wà ṣùgbọ́n àwọn nǹkan mìíràn máa ń ṣe nǹkan tó bá ṣe ẹni tó bá ní sickle cell tá a bá tiẹ̀ lé mú gbogbo ẹ̀ kúrò tá a bá lè gbé díẹ̀ ó máa ṣe. Tẹ́ ẹ bá ti gba card ìdánimọ̀ ní ID card yẹn hospital tí hospital ti kọ hospital sílẹ̀ ibi tí passport yín wà ìsàlẹ̀ rẹ̀ hospital tẹ́ẹ̀mù lọ ó ti wà bẹ́ẹ̀. So ẹni àwa ti forúkọ yín ránṣẹ́ sí hospital orúkọ yín ti wà lọ hospital already. So tẹ́ ẹ bá ti débẹ̀ ẹ béèrè ẹni tó ń jẹ́ desk officer ní hospital yẹn ẹ̀yẹ ṣáàtì na káàdì yẹn sí irú ilé ìbàdàn PhD. Tẹ́ ẹ bá ti débẹ̀ ẹ bá ti na káàdì yẹn sí òun á wo list tọwọ́ ẹ̀ tó bá ti rí orúkọ yín bẹ̀ bọ̀tàn wọn á kó káàdì fún ẹ lọ gbàgbé. Ṣé rí bó ṣe wà lọ́wọ́ yín yìí kò sí wípé ẹ wá sanwó káàdì kò sí bẹ́ẹ̀ ẹ ní sanwó pé ẹ fẹ́ rí dókítà owó oògùn gan ẹ ní san gbogbo ìtọ́jú yẹn ẹ ní. Ṣé ẹ wá rí nǹkan tó tún wà bẹ́ẹ̀ nìyí ìtọ́jú ò wá pín sí hospital ní wọ́n kọ orúkọ yín síbẹ̀ torí wípé wọ́n lè rí fáàyín ó dìpẹ́ lórí nǹkan tẹ́ bá gbé lọ hospital tí agbára hospital yóò bá ní ká wọ́n á kọ̀wé fún ìgbé hospital báyìí ní kẹ́wọ́n. Fún àpẹẹrẹ ọ̀pọ̀lọpọ̀ hospital yẹn wọ́n lè ṣe ìtọ́jú ojú àti eyín wọ́n lè ṣe operation tó bá nílò yẹn ó ti di dandan pé wọ́n á kọ̀wé fún ibi báyìí ní kẹ́kọ̀ọ́. Ibi tẹ́ ń lọ yẹn náà kì í ṣe pé ń lọ sanwó yàtọ̀ fún owó mọ́tò tẹ́ fi débẹ̀ yàtọ̀ fún owó mọ́tò tẹ́ fi débẹ̀ ẹ̀ sanwó. Ẹ rí i pé tẹ́ bá ń gbọ́ ètò OISHIA a máa sọ yìí pé bí ọ̀fẹ́ ni bí ọ̀fẹ́ ìtọ́jú ẹ̀ ní sanwó bọ̀ bí ọ̀fẹ́ bẹ̀ nígbà ẹ̀mọ̀ pé kò sí gbàmí téèyàn ò ní ná tọ́rọ̀ àbíkọ́ bọ̀ irú kẹ́ náwó mọ́tò sí ẹ̀ ti náà kankan díẹ̀ ṣùgbọ́n ìtọ́jú tẹ́ gbà gan ẹ̀mí sanwó. In fact tẹ́ bá wà lẹ́nu ọ̀ṣunjú tẹ́ wá ní ẹ sanwó fún nǹkan kan tẹ́ bá wọ ẹ̀yìn káàdì yẹn fóònù nọ́mbà méjì wà ń bẹ̀ fóònù nọ́mbà méjì wà lẹ́yìn káàdì yẹn lẹ́yìn fóònù nọ́mbà wà ń bẹ̀ tẹ́ bá tó má tiẹ̀ ní ẹ sanwó ẹ kàn á sọ pé ẹ̀ ń bọ̀ ẹ yọ fóònù ẹ kàn tó má tiẹ̀ ti rí pé ó ṣí àlẹ́ ń pè tó bá jẹ́ pé rọ́ ni wọ́n ti máa tọ́ka kò lé tó bá wọn. Owó ti ṣẹlẹ̀ dáadáa.
Ìmọ́tótó ló lè ṣẹ́gun àrùn gbogbo. Ẹ̀fọn tó gbòòrò àbò lọ́wọ́ àwọn tó rẹ̀rọ. Kẹ́kùn lè gbà kó sàbùn tókò. Cleanliness is essential. Immortalize your potential. Understand the times and your initial.
Mọ́tótó borí àrùn mọ́lẹ̀, àṣẹ ní ká ṣe lọ́jú. Àyíká aláboyún bẹ̀rẹ̀ aláboyún ẹ̀ fọwọ́ wọ́wọ́ ẹ jẹ́ ká ṣètọ́jú àyíká aláboyún.
You wanna live long and stay strong.
Here today to celebrate the goodness of your state because for the last 5 years we've been struggling to get the people living with sickle cell disease to have some form of insurance that can help them as they spend money on daily basis on the condition of their disease. So we approached them and they finally granted us 800 free spaces for insurance in Oyo State. So we want to mark that today, have the oil share representative come to explain the implications of having a card from oil share to take care of their health. And he's been here. So SCHAF is appreciative of that gesture, and that's why you are here today.
The speech I made about people living with sickle cell, they are part of the populace. We cannot leave them out. Health insurance is for everybody. And the whole idea of health insurance is basically healthcare financing. You have to manage your finances to get the maximum you desire for your healthcare services. So a managing fund, we can't leave them out. Yes, we might not be able to put a price on how much each warrior we need per year for care. But with health insurance, we can say we carry them. And like we do say in our office, our mantra is, you are looking for 1,000 naira, you subscribe to a scheme, either free or you pay. And that scheme will carry you to the tune of 800, 900, 500, 600. It means you are no longer looking for 1,000 naira. That scheme has carried you a bit. So that's the whole idea of health insurance. And that's what we are bringing on board for them. That yes, even if we cannot pinpoint to say this is the amount they are going to spend, but this scheme will still help them for other ailments. They do have malaria, they have other ailments. Some of them that are women will get pregnant. You understand? If we take all those out, and even on the insurance, what are the benefits there for them? Blood transfusion, to get some drugs for some other ailments. And we do know from experience that it is those that do not have the financial muscle that have this crisis often and often. Those that have the financial muscle, they hardly do. So if taking their hospital bill has been taken care of, they will have more money to eat well. When you eat well, you hardly fall sick. So that's the angle from where we are coming from. So to help them generally. And you see with all this, they will have more money to do other things, and there will be peace of mind.
The benefactors are sickle cell patients, that is, people living with sickle cell disease in Oyo State. We have over 1,000 people living with sickle cell disease as members of SCHAF, of Sickle Cell for Life Foundation. But because this is towards the end of the year, we are only able to find, I think, about 175 candidates for today to come here and pick up the scraps. But the others, as they register, as their yearly insurance goes off, they will register again with OISHA. So we are having more register in batches. But today is the first batch, and that's why we're here. Oyo State took the first step. They gave us on June 19, 2024, and that was the first one we had in Nigeria, that a state and organization would decide to bless them with this. But in the last 3 months, I see other states give like 30 or 100, but Oyo State is still breaking grounds by making sure we have 800 free spaces, which is a lot.
All over the country, there's no state health insurance agency that have only brought in pensioners on board. So officially, we are bringing in people living with the sickle cell on board officially. We've put them on the primary healthcare centers closer to their residents. Now, the first point of call is you fall ill or you feel your body is feeling somehow. You don't need to start traveling, going to the hospital. Go to that health center closer to your house that we've registered you. So at least first you get first line attention. Some of them will be stabilized from there, they will go back home. So if there's need for further treatment, they will be referred accordingly. And with the referral, worst case scenario is you pay for your transport. The treatment you are going to get, wherever you are referred to, you are also not paying. It's a win-win for everybody. And everything is geared towards you getting the best of treatment. When the doctor refers you, that means it has passed the level of that first line treatment. You need to go for second line treatment. That is where there is a need for referral. You understand? And it means you are following the rule of the expertise for that treatment, for you to get the best. You understand? So like I did explain to those that said they've been using UC before, if there's need for you to still use that UC, you will still use it. But the good thing now is you follow a different routine. Because you've seen the doctor first, he will refer you to UC. You will still use that place. And instead of you paying, you are not going to pay. So you see, it's a win-win.
You know, without insurance, it's hard for them because this is a disease that lasts your whole lifetime. And every day they are spending money on several things. So to have an insurance is a blessing, because if you don't have an insurance, some of them will just ignore their health status. They just stay in the house and say, I have no money for the doctor. I have no money to do registration. I have no money for blood transfusion. I have no money for anything because I have to eat, I have to transport. So if Oyo State has decided to give them insurance, it's a great break for them. And this will improve the health status of these people. They will not be afraid to go to hospitals. As they feel ill, they will get first-class treatment. At this attention, immediately they have issues. Some will stay there. They will not go to hospital. The situation deteriorates. So we don't want that happening to them. And we want to be sure that once they have any issue, they can get to even from the health center, the care begins. They get to the health center. And when the health center cannot handle it, they go to the general hospital nearer them. And at the last stage, they will get to the referral hospital, which is a tertiary institution like UCH. We don't want everybody swarming to UCH, but we want people to start at their local level. And if the doctors cannot do it, they will refer them to higher institutions. And this will improve the health status of these people and also the structural outlay of healthcare in Oyo State.
For SCHAF, 800. And the one we are flagging up to the land is about 140. There's still going to be another batch. They have the forms. As they fill the form, they return to us. We will do the ID card, enroll there, and return to them to distribute to them. We want them to use it. The whole idea is to reduce self-medication. That's what we preach for everybody. Once you have it now, use it. Don't do any self-medication. Don't say the last time I went to the hospital, no, this is the drug the doctor wrote for me. The doctor has a reason for prescribing that drug. So before you use any drug, go to the hospital, see the doctor, let the doctor run the test if need be. The prescription, let it be from an informed decision by the doctor. So go to the hospital as often as you need it, so that you get the best.
The federal government has a big role to play, and they're going to continue playing this role in different ways. So SCHAF is calling on the federal government to continue to help along this line, also to include in our curriculum the education about sickle cell disease. Nigeria is the epicenter. I keep saying it. We can't just keep quiet. In different areas, the federal government can do something. Let's have a curriculum that teaches children right from youth, and that's what SCHAF is doing. We're already in secondary schools in Oyo State, and we expect to extend it to other states in the country, so that at that level of SS1, SS2, children will know exactly what this disease is about, what are the challenges, how can it be cured, what can they do about it, how can they ask for help, where should they go. All these are being taught to them in the secondary school level, to have an attitudinal change and make sure that people understand what this disease deserves to have attention about. And like I always say, Bahrain reduced its population of sickle cell patients from 2.1% to 2.2% within 37 years. Nigeria can do it. There are many ways in which it's only if the government steps in. The government has to step in. Right from pregnancy, we do prenatal diagnosis free of charge. So the mother at birth, before even birth, the mother knows that she's carrying a child with sickle cell disease and is prepared to receive that child. As soon as that child is born, if he doesn't abort that pregnancy, we don't have abortion in Nigeria. So we are not praying for it. But if you know you cannot cope, you may decide to abort. That's the only thing with the pregnancy and prenatal diagnosis. But as soon as you have this baby, the day you have the baby, there should be free newborn screening. That's what they were doing in Bahrain. Free newborn screening right once the child is born. Within the day or two that the child is born, newborn screening is done. The mother already knows, is told that this child will develop into an SS. And if he has SS, you need to go to so and so places. They are referred, and by 2 months of age, the government starts to provide the vaccines to attack this disease at the age of 2 months to 5 years, free of charge for these children, so that the infections are reduced and everybody knows where to go. That's part of it. And then after that, by the time a child is 1 year old, the full formed hemoglobin is there, and the hospital should be able to diagnose using a point of care diagnosis, so that we don't have to make mistakes and do human errors. These people are properly diagnosed at that point. And then as they go on in life, they understand, they are taught, they are counseled, and the burden reduces gradually. And over the years, people have awareness and they know the preventive approach. And so, over a period of 40 years, Nigeria can bring down this thing to a much reduced level. We are still at 2.1. And we even think it's increasing. And by pronouncement, by 2050, if we don't do anything concrete, we don't have a national plan of how to reduce this thing, it might increase with another 2/3.
Ribi,